It's Chris Byer.
Hey, it's Chris Pullen. What up, CB?
CB, we're in focus with Cam James from our West Des Moines office. Cam, thanks for joining us today in focus.
How's it going, guys? How are you, Cam?
Good. So we know you've done some specialization in the insurance world. Tell us a little bit about who you are, your background, and kind of what brought you to AP.
Yeah, absolutely. Cam James. I've been with AP for 4 years now, which is crazy to think. It feels like yesterday. I lead our healthcare team on the property casualty side out of our West Des Moines office. So we specialize in working with hospitals, physician groups,
Yeah.
really anything healthcare related, but primarily focusing on hospitals and physician groups.
And how did you get into insurance to get and maybe focus on that background? What brought you to that point?
Yeah, absolutely. So I've been in the industry for 11 years now, which is also wild to think about. But I kind of fell ass backwards into insurance right out of college. I grew up in Dubuque, Iowa originally, and got an internship with a large brokerage firm there and loved it. And so they offered me a full-time job after college, which was nice because I didn't have to do the job search. And
Yes.
kind of the rest is history. So moved to Des Moines about 8 years ago and ended up getting hooked up with LMC, which was acquired by Assured Partners, and that's long story short how I'm here now.
Very similar, CB. How about that?
Right.
Starting as an intern in college in insurance because we didn't have anything else to do. So
Yeah, exactly. Couldn't get anywhere else, so we
that's
took
very, very
specialty
similar here
insurance
for the
route.
two
That's
of
what I
us.
said. I was probably not going to get a job anywhere else. So hey, why not
Yeah.
some insurance? Exactly.
So Cam, what led you to the specialization in healthcare? Because I know that's such a complex industry. You know, a lot of the markets you're working in, we've got rural critical access hospitals that are struggling for funding, dealing with a lot of challenges. But how'd you gravitate toward that?
Yeah, good question. So when I started at AP 4 years ago, we had a very unique, I'll call it a program through the Iowa Hospital Association that was very work comp driven.
Yeah.
And so we really started there and worked on a lot of the work comp programs for many Iowa hospitals. And throughout that process, learned that we had a pretty unique story to tell
Yes.
in the hospital space. And so with that, I mean, really just expanded outside of work comp to other lines of coverage like property, medical malpractice, professional liability, and most recently cyber liability. So it really started with kind of that Iowa Hospital Association connection network of hospitals, and we've grown it now to states like Minnesota with the Minnesota Hospital Association, Illinois with the Illinois Critical Access Hospital Network. Also, Indiana and Wisconsin are in the mix, and now Missouri. So we're kind of expanding that and growing in other states, which is really exciting.
Well, so many risks that the hospitals have in front of them. I think you'd probably say one of the more emerging ones and probably one of the more difficult ones is cyber. That it'll shut down the entire operation of that hospital. You've probably seen that quite a bit. You're probably helping a lot with undoing some of those issues.
Yeah, it's unique right now. I mean, that's the number one risk, in my opinion, and with the data that shows that hospitals face today is a cyber attack. Right now, we're seeing it day in and day out. And I was actually on a call this morning, kind of working through a cyber incident that one of my clients had, and yeah, it's very unique, very specialized. But we've have the resources to help, and that's what we try to do.
Yeah. Now, Chris, I like the fact that Kim gets to specialize in one industry. I mean, we work a lot on health plans across industries, but we don't get as much inner working knowledge of the organization. We know about their people, their culture, but to understand what keeps that business running, totally different approach and conversation that you have with clients than maybe what we would have.
Yeah, absolutely. I'm just so impressed, Cam, with your knowledge. I mean, we've sat through many meetings, and I can't think of anybody else we would want in the room that could talk about property casualty when it comes to a healthcare system,
Yeah.
or a small hospital, or even a, doctor group, physician group. It's just your wealth of knowledge far exceeds the amount of years that you have been in this industry. I appreciate that. I appreciate that. Keep it
Well,
coming, boys. I like the compliments. Can we keep this
maybe hit
thing
him with the
rolling
hard
for
one
like
then.
30? We get this thing going for
Hit him with
30
the hard
minutes.
one.
I'm,
Let's
I'm
finish
good.
this up.
Yeah.
All right.
Yeah. Here's the hard question, or really an easy question. You've had a good day, bad day, hard day, miserable day. Do you have a motto? Do you have something that just resets that day for you? Yeah, good question. Anybody who knows me knows that I love the golf course, and I love a cold beverage. So Anytime I have a hard day, I try to combine the two of those, and it usually makes me feel a lot better. So,
This is
um,
prime time then, middle of the summer for you. So
Yeah.
yes,
exactly. Hence, I'm wearing a polo today.
yes,
Yeah.
Hoping to get out after work. But
Right
yeah,
on.
that's probably my number one thing for
I
sure.
love it. I love it.
awesome. Well,
Here
Cam,
we are
thanks for spending some
making,
time with us. Let us get to know you a little bit better and share what you're doing for hospitals and healthcare organizations across the Midwest. Appreciate your time today.
Absolutely. Thank you
all right,
guys.
We'll see you.
Appreciate it.
see you, buddy. Take care.
Yep. Take care.
All right. Bye-bye.